everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS. So let's just continue our counseling structures and counseling stations. Okay. So now you're very well aware about the structure that you need to follow for the counseling station and the approach that you need to take. Okay. You're well aware of the box system and you're well aware of what to do when it comes to the management as well. Okay. So now let's just one by one keep on discussing a few examples of each category and how you can apply that particular box system in every category. Okay. So I'm just going to discuss one case from each category because it's a very huge syllabus. There are like 100 plus cases. So you just get an idea of how to go about a particular category, and then eventually just when you're practicing, when you're reading those cases, try to apply this particular structure and this particular approach in the station that you're going to study. Okay. So let's just move on with the test result stations. Okay. The test result station would present in this way, in which a patient would be there, and some test results would be mentioned over here. Okay, like for example, in this case, the full blood count, uh, HbA1c, cholesterol, LFTs, which are the baseline investigation, they are mentioned, and serum ferritin is also mentioned, and serum iron is also mentioned. Okay, so you can see from this particular case note that the patient has a low hemoglobin, number one, and the patient has got low ferritin and low iron. Okay, that means that this is typically a case of iron deficiency anemia. All right. So as I tell you that in the counseling stations, the diagnosis is there. Okay, it may not be written directly, but the test results would be indicating towards a particular diagnosis. Okay, so you have the diagnosis in your mind, in your head. It's very clear. Okay, you would just have to explain the test results to the patient. Okay, now let's just go through each box. Okay, box 1, 2, 3, and what to do in a test result station. Okay, the box 1 was ice. Okay, so in ice you gotta ask about the idea. Okay, do you have any idea about the iron deficiency anemia, or do you know what it is, or do you know what are the risk factors? Okay, or do you have any idea about your condition? Okay, do you have any idea about the test results, why these particular tests were done? Okay, and why did you get these test results done in the very first place? Okay, so that is what the idea part is. Okay, and this is what you need to do, and this is exactly what you need to ask whenever there's a test result coming. Okay, then the concerns. Okay, concerns may directly be there in the very first go. Okay, or they may just come later in the consultation. Like for example, in this particular case, the patient may just give you a concern that, doctor, my only concern is that why am I feeling tired? Okay, because this patient was initially feeling tired. Okay, so this is what the concern may be, that, doctor, why am I feeling tired? Or the concern may be that, doctor, what is there in my test results? I want to know, I want to understand why these tests were done. Okay, so this is what their concern may be. Okay, or they may just drop a few concerns later on in the consultation when it comes to the test result stations. Okay, and then expectations, that what is your main expectation as of today. All right, now what is more important is the box number 2. Box 1 is like easy. Okay, you just need to ask about the idea, concern, and expectations. Okay, this is pretty much straightforward. Box 2 is important. Okay, in the box number 2, the first part that we talked about was basically exploring the situation and exploring the symptoms. Okay, so since this is anemia, okay, you got to explore the anemia symptoms. Okay, this is what you can explore. Like for example, the patient, yes, they presented with tiredness. Okay, so you can talk about tiredness. Okay, but apart from tiredness, you can ask about the other symptoms of anemia. That, okay, by any chance, did you develop any fatigue? Did you develop any shortness of breath? Or did you develop a rapid heartbeat, or are you having any pale skin? Okay, but very briefly, to be very honest, you don't need to go into a very like detailed approach, and you don't need to ask a lot of questions regarding this. Okay, just very briefly touch upon the anemia symptoms, and you can explore, ask a few questions about tiredness. Okay, but again, that is like optional. But you can just ask, okay, the what, when, why of the tiredness, and how long have you been feeling tired. They're going to say, yeah, for past 3 weeks. Did you do anything to make it better? Did you do anything that made your tiredness get worse? Okay, so just a couple of questions. Okay, not a very detailed approach that you need to take. The more important thing in the data gathering over here would be the risk factors. Okay, like for example, somebody is presenting to you with a particular disease, okay, and then you have the test result of that disease in your hand. You want to ask about the risk factor of that, of those the disease or of that particular disease. Like for example, you got to ask about malabsorption syndrome. Like for example, do you have difficulty to flush your stool? Is your stool foul smelling? Okay, then the patient may be getting iron deficiency. If they may be having some bleeding tendencies, that by any chance do you have bleeding gum problems? By any chance do you have nosebleed? Okay, and then you're going to talk about the dark stools or peptic ulcers. Okay, like do you have a history of any abdominal pain? Do you feel that the color of your stool is a bit dark? Okay, and if it's a female, you're going to ask about periods. Like if the patient is having very heavy periods, then it's most likely that she's going to develop iron deficiency anemia. So you're gonna ask about the heavy menstrual period. Okay, like all the risk factors. Okay, you just think about a risk factor and you have to ask about. But most importantly, in this particular case, would be the diet. Okay, can you please run me through your diet? Can you please tell me more about your eating habits? What do you eat? Okay, so diet is like particularly very important. Okay, somebody is saying that they are on a vegan diet. Okay, then it's very likely that they will develop anemia. Okay, if their diet is not iron rich, talk about do they take meat in their diet? Other than that, do they take spinach? Okay, apple. Okay, and the food that is rich in iron sources. Okay, just directly talk about those, because you know that this is an iron deficiency anemia. You got to ask about the iron rich diet and the nutritions that is rich in iron. So just directly ask about those questions. Okay, that is what exploring the risk factor is. And in this particular case, the risk factor would be way more important than any other part of the box number two. Okay, so you got to explore this, because at the end of the consultation, they may just throw a concern to you that, doctor, why did I develop this iron deficiency anemia, or why did I develop multiple myeloma? Okay, so the risk factors becomes like really important. Okay, then the third one is the complication or the red flags. Just think about the complications of anemia. Patient can have dizziness. Patient can have, because of the dizziness, the patient can end up falling somewhere. Okay, the patient may develop some chest pain as well. Okay, so just ask about the complications and the red flags of the disease. Okay, uh, you can think about any disease. Okay, and there would be some complication or the other. Okay, then meftosa can be asked. Okay, and as I said in the last lecture, that you don't need to go into the entire detail of the meftosa. Okay, not all the aspects, but a few aspects. Like for example, medicine such as NSAIDs in this particular case. Why? Because you know that NSAIDs is a risk factor for developing peptic ulcers. Okay, and somebody, if they are taking NSAIDs for a very long time, they may develop peptic ulcers. Okay, and that peptic ulcer may be resulting in anemia. Okay, then you got to ask about the family history to rule out the heme disorders like thalassemia, like sickle cell diseases. Okay, the causes of different causes of anemia needs to be ruled out nevertheless. So just talk about the family history very briefly. Okay, then psychosocial aspect, that who do you live with, how are things at home. Okay, just to touch upon the psychosocial aspect, just to make sure that the patient is completely all right. Because why? The complications of iron deficiency anemia, you know that the patient can have dizziness, the patient can have falls as well, the patient can develop a chest pain as well. Okay, so all of these things, the patient like this, it's important that they're not alone. Okay, it's important that they are, they have the support available. So psychosocial aspect would become particularly important in this case. Then naming the correct examination. Okay, you know that in iron deficiency anemia, or in just in anemia. Okay, you got to look at the eyes. Okay, then you got to check the skin for any pallor, and then you got to check the nails for any changes like cornecia that may be there in iron deficiency anemia. Okay, so you see the six aspects of the data gathering. If you pick up any disease and you just apply those six aspects of box number two, there wouldn't be any aspect of the disease. There wouldn't be any question that would be left. Okay, you can think about a question and it would be placed in any of these six different parameters that I talked about when it comes to box number two. Okay, so this way, like why this structure is important, why this box number two is important, because you would automatically, even if you don't remember the questions, like it's not easy to remember all the data gathering questions for 600 cases. Okay, but if you just know the basic structure, like for example, you know that in the first thing you need to explore the situation. Okay, and it's very very like simple that what symptoms can be there in an anemic patient. You know that this is a case of anemia, so it's very easy. Then okay, the fatigue can be a symptom, shortness of breath can be a symptom, rapid heartbeat can be a symptom. Okay, tiredness can be a symptom. So if you just know the category that you need to assess, the category that you need to touch upon, okay, automatically you'll get those series of questions in your head. Okay, so try to go from category to category. Okay, the six parameters. Try to do your data gathering from parameter to parameter. This way, your data gathering would be very much structured. Okay, and the chances of you missing out on essential data gathering questions, and this is why I call it the essential data gathering questions. Okay, because they're like really important. Okay, and you don't want to miss out on them. Okay, so this way you're gonna cover the essential data gathering aspects for sure. Okay, then how do you explain a particular test result? Okay, the explanation is simple, that thank you so much for answering all my questions from the chat that we have had and from my examination findings, and the test results that are there in my hands right now. Okay, it shows that your hemoglobin is low. Okay, detail number one. And so is your blood iron levels, leading to a condition called iron deficiency anemia. So you see, you have to talk about the deranged values. Okay, you have to talk about the the test results that are deranged, that are not normal. Okay, you cannot just get away by saying, okay, you are having something called the iron deficiency anemia. Use the test result, that your test result shows that your hemoglobin is low, and so is your blood iron level, leading to a condition called iron deficiency anemia. Okay, and then explain that why is it happening. You gotta say that, okay, iron is a crucial chemical that is needed for blood production in the body. Okay, and since you mentioned that your diet lacks red meat, which is a risk factor for your deficiency. Okay, explain it completely, explain it fully. Okay, don't just say that, okay, this is an iron deficiency anemia and just move on to box number four. No. Okay, make sure that you explain it completely. Okay, like if I am doing it, and if this situation comes to me in my exam, then this is how I'm going to do it. That Okay, Mr. Peter, thank you so much for answering all my questions. So I have your test results with me in my hand, and what they show is that your hemoglobin, that is the major component of the blood, that is quite low. Apart from that, all the other baseline investigations are found to be normal. However, there is another specific investigation that we did, which is called your iron profile, which shows that your serum ferritin and your serum iron, both of them are the component which shows whether or not the iron is deficient in your blood or not. And they show that both of them are like really, really low, which means that your low hemoglobin or your anemia is because of the iron deficiency. And we call this condition as iron deficiency anemia. Are you following me so far? All right, okay. So, do you have any concerns regarding this? Yes, doctor, why did I get it? Well, since you mentioned that your diet lacks red meat and you prefer a vegan diet, I would like to tell you, Mr. Peter, that the people who just follow the vegan diet and they don't take any meat intake, they often result in getting the iron deficiency. As a result of which, their iron deficiency anemia is very, very common in those people. Does that answer your concern, Mr. Peter? Yes, doctor, definitely. What are you going to do about me now? And then you move on to your box number 4. Okay. So you have to explain each and everything. Hemoglobin is low. Okay. All the other investigations are normal. Fine. We did another test called the iron profile, in which shows that ferritin is low. Your iron is also low. Okay. And this shows that there is an iron deficiency leading to the anemia that you are having, that leading to the low hemoglobin that you are having, and that is what the reason is for your tiredness. Okay, why did I develop it? And then you use the data which you just got, the risk factors that you got in the diet part, and then you address the concern of the patient in that particular way. Okay, then you move on to box number 4 after you have explained it, after you have did the box number 3. Okay, then box number 4, that so as I mentioned, that they may throw more concerns. Okay, they may just keep on dropping additional concerns. Okay, as I said earlier on, this particular thing, that there may be additional concerns in the consultation after you have done explaining box number 3. Okay, like for example, they may ask, okay doctor, am I pre-diabetic? So you're going to answer that no, your HbA1c, which is a parameter that we to see to check whether or not a patient is diabetic or not, that is found out to be normal. That is 5.5%, which is within the normal range. But if you are concerned about it, we can do further investigations, or we can check your fasting blood sugar, or we can check your random blood sugar. Okay, one concern. Another concern that they may just show you, okay, is what is my condition? You've already talked about it. Is it serious? You can say that no, this is not serious, this is a very common condition. Okay, and it is a pretty manageable condition, and we can definitely manage it with some iron supplements. Okay, then why do I have anemia? Okay, we've already discussed this. Okay, that you have anemia because your diet lacks red meat. Okay, which is an important source of iron that is lacking in your diet. Okay, and then they may drop some more concerns when you talk about the medication, that how do I take the tablets and for how long should I take the tablets. So I've listed down all the concerns over here. Okay, they may pop up and they may come to you anywhere. Okay, anywhere in the box number 4. Okay, so let's just discuss how you're going to address. Always first address the concern and then move on to the advices, referral, and management. Why? Because a lot of aspect of the A, R, M, and S. Okay, the advices, referral, management, and safety. Okay, a lot of the aspects you would be covering in the concern part. Okay, you would be covering it in the concern part. Okay, so do not just worry about the fact that okay, I need to give a lot of advices, I need to make a referral, I need to manage the patient, I need to give a medication. Okay, they may just ask any one of these aspects in the concern. Like for example, they may just drop a concern that doctor, what will you do for me? Okay, it means that they are asking for a medication. Okay, or what treatment will you provide to me? Okay, so even though it's a concern, but it's part of the medical management, so you'll automatically just break the chain and then just move on to the management part. All right, so make sure that you are flexible on this, specifically just in the counseling session. Okay, because addressing the concern is way more important. Okay, maybe the patient is not very much inclined about getting advices from you. Okay, maybe the patient wants to take a medication. Okay, then you would have to leave the A and the R part and just move on to the M part when you are addressing the concerns of the patient. Okay, so yeah, what are the possible advices you can give? That try eating red meat. Okay, and then as I mentioned, that you give a solution, you give an explanation, and another concern may pop up. Like for example, the moment you say that okay, try eating red meat, they will drop a concern. Doctor, I cannot take red meat. I am a vegan and I want to stick to being a vegan. Okay, then you gotta give alternative. Okay, remember what I told you in earlier on, that a good explanation, a good counseling is in which you are able to suggest alternatives. Okay, Like for example, in this case, they say that okay, I'm a vegan, I cannot take red meat. Then you suggest alternative that okay, if you prefer to avoid red meat, that is fine. Can you consider taking dark green vegetables and dried raisin instead? Because the dark green vegetable and raisins are also uh, high sources of iron and vitamin B12. Okay, so make sure that you are ready to give alternatives. Okay, you are ready to give alternatives as well. That is what would make you a good doctor. That is what would make you a good counselor. Okay, it's not always about imposing your ideas on a patient. Okay, counseling is not about that. Counseling is trying to reach a middle ground, trying to make sure that the patient is also comfortable and the patient also agrees on following your advices. Okay, then if they may ask that okay doctor, what else can you do for me, then you can make some reference that okay, a dietitian will further provide you dietary guidelines in a much better way. They can help you create plans and create meal plans that will make sure that enough iron or even enough vitamin B12 is going in your diet, and you're not developing any anemia in the future. Okay, and if let's suppose that you suspect that the patient is bleeding, okay, why do we ask this thing in the in the risk factors like malabsorption syndromes, and we also ask about the bleeding tendencies. Okay, bleeding gums and bleeding nose, and the peptic ulcers. Okay, because we need to use this particular information in our management as well. So if the diet is not the cause, let's suppose if it's because of a bleeding issue, okay, then a referral may be needed to a gastroenterologist to find the source of bleeding by either getting a colonoscopy or an endoscopy done. Okay, so you may have to just do a referral over there. Okay, then comes the medical management of it. Let's suppose that are done answering the concern, or if the patient like directly asks the doctor, what treatment will you give to me, or what treatment will you provide? Okay, then the management for iron deficiency anemia, you should know about it. That okay, it's ferrous sulfate, 200 mg orally, that is taken for 6 months. Okay, and when you say that, the patient may just drop another concern to you, that doctor, how should I take the tablets? Okay, again a concern can come up, how should I take the tablets? Okay, then you can say that okay, you can take it with water, preferably with or very soon after the food. Okay, you need to have the answers to every question that a patient may just drop in a particular station. All right, then the patient may just drop another concern, the doctor, what are the side effects? Okay, the side effects may include stomach pain, nausea, some heartburn, okay, and dark stools as well. Okay, so make sure that you are ready to address all the concerns of the patient, and they may pop up anywhere. Okay, the CARMS is basically just done to just give you an idea that what are the important things that you need to cover. Okay, but unlike the other station, as I mentioned, there is no hard and fast rule to follow the same protocol. Okay, whatever the patient concerns is, always focus on the concern first. Forget about your CARMS protocol, and once you've done addressing the concern, then go back to it. Okay, and then safety netting can be done for side effects. Okay, and you can call the patient for a follow-up as well. All right, so this is the approach that you need to have, and this is how you're going to apply the four box approach that I taught you, inspired by Dr. Lovaan, that needs to be applied in different type of stations. Okay, this is for the test result stations. Okay, uh, now I hope this is clear. There are like like many decimal stations. Okay, I think there would be a good 20-25 decimal stations. Okay, make sure that you go through all of them. Okay, try to read the notes and apply the knowledge as per this particular structure, so that you are very well aware that what question to ask in what case. Okay, and then how to eventually manage the patient as well. All right, now let's just end the lecture for today. Okay, before we move on to the next lecture, that is the relative counseling that we'll be doing in the upcoming lecture. But if you've got any questions, any queries and any confusion, regarding the test result format and what to do in a particular test result station, then please drop them down in the comment box, and you can reach out to my social media as well if you got any queries. I would love to address all your concerns over there as well. Okay, that's it pretty much from my side. See you in the next lecture, in which we'll discuss about the relative counsel.